All right, today we're tackling an injury that honestly, even seasoned orthopedic surgeons get a little nervous about, the talar neck fracture. This isn't your average break. It's a really high-stakes injury with a notoriously tricky road to recovery. But before we get into all the surgical details, let me ask you something right off the bat. If you had to guess, what is the single most vulnerable bone in your entire ankle complex? The answer might not be what you think, and honestly, it's the key to understanding this entire story. So, here's what we're going to cover. First, we'll meet the ankle's keystone bone. Then we'll see how surgeons classify these fractures. After that, we'll look at the treatment timeline, dive into modern surgical repair, and finally, we'll talk about the aftermath, the serious complications, and the signs to watch for. Okay, let's get right into it. Time to meet the star of our show, or maybe the victim in this case, the talus bone.
You know, the talus isn't just some random bone. It's really the keystone of your whole ankle. Think of it like the central stone in a Roman arch that holds everything else up. It's the critical link, the main connector between your leg and your foot. It's absolutely essential for pretty much any movement you make.
So you're probably thinking, why is this so-called keystone so easy to break? Well, it's kind of got a few design quirks, let's say. For starters, most of it is covered in slick cartilage, which is great for smooth joints but terrible for healing. Get this, there are 0 muscles that attach directly to it. On top of that, its blood supply is super fragile and flows backwards, making it easy to disrupt. And to cap it all off, the neck of the bone is its weakest point, almost designed to snap under the massive force of a major accident. Okay, so when this crucial bone does break, how do surgeons even begin to figure out how bad the damage really is? That's what we're getting into next. It's all about classifying the fracture, because that's what helps predict the outcome.
Whoa. Okay, just look at this x-ray. This is what we're talking about. This is not a subtle little crack. You can see the talus bone is not only broken, but the main part of it has been violently thrown out of not one, but 2 major joints. This is what we call a true orthopedic emergency. No question about it.
So how do we make sense of that chaotic x-ray? Well, this table right here, the Hawkins classification, is basically the Rosetta Stone for these injuries. A type 1 is just a simple crack, but as you go down the list, things get exponentially worse as more joints are dislocated. And check out that last column. It's chilling. The risk of osteonecrosis, that's literally bone death from a lack of blood, it just goes through the roof, hitting up to 100%.
Now, with an injury this bad, your first instinct is probably get them to surgery now, right? Well, you might be surprised to hear that the thinking on that has done a complete 180 over the years.
And that leads us to a really important question, one that really shook up the old school way of thinking. Do you have to do the final big surgery immediately? Is rushing always the right answer?
And here's that shift in thinking, side by side. The old dogma was, go, 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 we gotta plate it right now to save the blood supply. But it turns out the real damage to the blood vessels happens the second the injury occurs. So the new thinking is smarter. Step 1 is an urgent reduction, which means just getting the bone back in the socket to take pressure off the skin. Then, you can actually wait for all that massive swelling to calm down before doing the final definitive surgery with plates and screws. Okay, so the patient is stable, the bone is back in place, and the swelling has finally started to come down. Now it's time for the main event, the actual surgery, to piece this incredibly complex puzzle back together.
You can't just make one little cut and hope for the best with a fracture this complex. To really see what's going on and line everything up perfectly, the gold standard today is something called the dual incision approach. It's all about getting the best possible view from 2 different angles. So here's how it works. They make one incision on the inside of the ankle, the anteromedial one, to see that side of the break. Then they make another one on the outside, the anterolateral one, to see the other side. But the really clever part is this skin bridge they leave in the middle, at least 7 centimeters of untouched skin to keep the blood flowing. This 2-pronged attack gives the surgeon a complete view to get those bone fragments lined up perfectly before they lock them in place.
But here's the thing. Even after the most beautiful, textbook surgery, the fight is far from over. The road to recovery is long, and there are some really serious storm clouds on the horizon. So what are they, and how do we even watch out for them?
Okay, let's talk about the big bad wolf of this story. It's called osteonecrosis, or AVN for short, and it's exactly what it sounds like, bone death. It happens because that fragile blood supply we talked about earlier gets completely destroyed during the injury. It is, by far, the one thing everyone is terrified of.
Now, for a really long time, there was this one hopeful sign doctors would look for on an X-ray a couple of months after surgery. It's called the Hawkins sign, and seeing that little dark line under the bone's surface was like a collective sigh of relief. It was thought to be the all-clear signal that the bone was still alive, a really good omen.
But, and this is a huge but, it turns out that good omen might not be so good after all. In a real plot twist, a massive new study just came out in 2024 showing that the Hawkins sign, well, it's basically no better than a coin flip at predicting what's really going on. So that sign we relied on for decades? Yeah, not so reliable.
And if that wasn't sobering enough, that same study dropped this bombshell number, 42.1%. That is the overall rate of bone death in these fractures, even with all our best modern treatments. It just goes to show you, this is an absolutely devastating injury.
Okay, so let's wrap up with the key takeaways. First, the talus is that vulnerable keystone of the ankle. Second, the Hawkins classification is our guide to how bad the damage is and what the risks are. Third, the new rule is reduce it urgently, but you can wait to fix it definitively. Fourth, that dual incision approach is how we get the best repair. And finally, the big one, bone death, or AVN, is still a massive risk we have to contend with.
So all of this leaves us with a really big question for the future, right? We've gotten incredibly good at the carpentry of fixing the bone, the plates, the screws, the alignment. But the plumbing, keeping that blood supply alive, is still a huge challenge. The next great leap forward isn't just about better screws. It's about figuring out how to predict, or even better, how to prevent bone death before it even starts. And that's the real puzzle left to solve.